And now I will give the floor to our first speaker, Dr. Mexia. Thank you.
Hello, good afternoon, everyone. It's a pleasure to be here, and I'd like to thank the invitation to EUPHAnxt and congratulate you on being so dynamic in producing these types of events and also sharing information among the younger experts in public health or future experts in public health across Europe. I'll share my screen. I have a couple of slides, but I'll be looking forward to the questions and to the discussion afterwards. So the topic I'm going to share with you is re-emerging diseases and preparing for the challenge. I'll just start by quoting a historical document where the Surgeon General of the US, William Stewart, in 1967, actually was quoted saying that because infectious diseases have been largely controlled in the US, we can now close the book on infectious diseases. And the setting was actually quite prone to this type of statement, because we had good control of communicable diseases. They had eliminated smallpox in the US, and we were on track to eradicate smallpox, which was the only disease we've managed to do so so far. There were several new vaccines, new antibiotics being delivered to the market. And we had the significant improvement in sanitation across the world due to access to potable water, adequate nutrition, and also improvement in food safety. So this was actually something that there was quite a confidence that infectious diseases would be a thing of the past. But then again, a lot of things happened. So we've had in the 80s, the HIV Aids epidemic, which was devastating at its early stages. Nowadays, it's more like a chronic disease if an infection gets detected early on and is adequately treated. But at the time, it was a very, very severe disease with a lethality which was very, very high. West Nile outbreaks started to show up in different countries. We had the SARS in 2003, the first, let's say, the first SARS outbreak, which spread across the world really fast. Then we've had the MERS outbreak as well. And of course, COVID-19 now is also a significant problem. Tuberculosis and malaria, especially in the resistant forms, antimicrobial resistance across different diseases, especially those that connect with healthcare. There's a significant number of antimicrobial resistance cases in that setting. We had in 2009 avian influenza, then the huge Ebola outbreak in Western Africa, which we've been having outbreaks of Ebola and Marburg since the 70s, but this was really a very, very big outbreak. Reached roughly 30,000 cases and 11,000 dead. So it was a very, very significant outbreak. And then Zika, with a very fast spread as well along several regions of the world, and of course the pandemic we're now facing. So somehow the statement that we would be free from infectious diseases did not follow through. And of course we know that when we consider burden of disease, especially in the richer countries or the most industrialized countries, we know that the vast majority of disease is now from chronic and from diseases, degenerative diseases that we're facing. So coronary disease, cancer, diabetes, mental health are probably the biggest burden, and infectious disease has been shrinking in size. For instance, in Portugal, before COVID pandemic, we had roughly 6% of the burden of disease was due to infectious disease. But nevertheless, as we've seen, it can have a significant impact in the health of the population and of the world. So we really need to upgrade our response. We have an increasing population. We have people concentrated in urban areas with a close animal and human interface, which, for instance, might explain eventually COVID, eventually the Ebola outbreak in Western Africa, and of course the avian influenza ones. We have a significant speed and ease of travel, so disease knows no borders and it can easily go across the world. Of course, climate change, which is the significant topic for today, because vectors who are away from some regions are now coming back. We've been having misuse of antimicrobials in different settings, both in humans, but also in animal production. So it's a significant problem. War and conflicts, for instance, what's happening in Syria, which had a good vaccination program in place, now is really dramatic what's happening there concerning infectious diseases. And of course, an aging population, which also has waning immunity, which is also a significant problem. Back in 2018, the WHO usually does this review of what should be the priorities for research and development. And it's interesting to see this list. There's no particular order for the diseases, so all of them were considered very significant. It was a panel of experts that had significant work in identifying the ones where we should allocate more resources. So we do have Crimean Congo hemorrhagic fever, Ebola and Marburg, Lassa fever, MERS and SARS. And I remind you, this was 2 years before the start of the pandemic, Nipah and Nipah viral diseases, Rift Valley fever, Zika, and disease X. And I'd like to focus on this disease X because if I ask you what's the agent of disease X, you probably won't know. And I also don't know, and even WHO doesn't know, because this disease X is a way of signaling that we should be aware that the next threat to public health at a global scale might come from a disease we have not yet identified, and therefore we probably will be blindsided by these threats. So we should be careful about that. I just brought you the health map. This is a partnership between Harvard and Johns Hopkins. And it's quite interesting because it does survey the world for public health emergencies, especially for communicable disease. And as you can see, of course, a significant number of these now are concerning COVID. But if you were to search for it in 2018, you'd have a very similarly spotted map as it is right now, because emergencies do occur around the world, around the clock, and at different settings. So we should be aware that we need to intervene and prevent these types of threats at an early stage, preventing them from gaining more ground and eventually evolving to be a pandemic threat, such as happened right now with COVID. And what can we do to try and stop this? We need to be prepared. And that's more or less what I would like to focus now. This is a tool from WHO. It's actually a response from WHO to a previous tool that was created by the US, which was the Global Health Security Agenda, which somehow tried to assess capability of countries to respond to public health threats. And of course, there was a political issues with the US leading this task, and therefore WHO set up this joint external evaluations where countries can ask to be assessed. And they can have a self-evaluation. They'll have a team of experts come over and discuss with them, and they will identify the threats or the vulnerabilities of the country in terms of responding to a threat. And eventually, this document will enable them to design plans, action plans, in order to improve their capacity to respond. There's 19 technical areas that are assessed. Each of them has a checklist which you need to address. And of course, they're somehow organized into three major areas. So prevention, detection, and response. And of course, this is a very interesting exercise. I had the chance to participate in several WHO meetings and actually be team lead in a couple of them. Because you do understand that different health systems do face different challenges. And of course, somehow the more vulnerable countries with less robust systems, of course, score lower in this assessment, and there will be probably the countries with more resources will score better. But still, if we were to apply this to Portugal, you would still identify several areas where we need to improve. So I would advise to all countries, and not many European countries actually have undergone this evaluation, all countries should do so in order to prevent the next pandemic. There's a lot of resources to be applied, and I guess that the significant funds involved in the Recovery and Resilience Facility will probably be very useful towards this preparedness. Of course, Europe has realized that we need to enforce health a little bit more, so the HERA will be very important as well. But we might also be considering the fact that a chronic disease such as cancer also needs our attention, and therefore the Beating Cancer Plan is also a tool that we should not overlook in preparing for health threats that all the countries are facing. And this is what I had to share, and I'll gladly participate in the interaction with the participants right now. Thank you so much.
Thank you. I think that was great. I would like to ask to add for the participants that if they want to ask anything at any point, they can use the Q&A session option, and at the end we will be more than happy to answer all the questions. And now, as we want to be as interactive and have a small space between each presentation that we can take as food for thought and letting ourselves to process what we have heard, Charlotte will ask you. Yeah, that would be great.
Share, yes.
And Charlotte will share a short question.
Hi, so if you open up the chat function, there will be a link that you can click and help and interact with us with a question here regarding our last presentation. I'm going to share my screen.
Charlotte, it might be useful to send the link once again for those that joined a bit later.
Yep, let me do that. Sorry about that. It's in the chat function if you need to find it.
I see that we have so many nice answers like improving myself, communication, information, teamwork, joining forces. I think I really appreciate the joining forces and coming together spirit. I think it's really, really nice to see it here highlighted. And also, of course, we have the scientists and us that are making their presence felt. I think that Professor Marija wants to say something, please.
I would like just to add that I really enjoyed Ricardo's presentation, and that I think that, as you said, it is also my conclusion that we closed the infections disease book before we have to and should. So we now have to open again.
We were forced to open the book, and unfortunately it's likely that we'll need to reopen it in the future, hopefully with not as many chapters as this one had, because it's been far too long.
I'm afraid that it will be combination with the demography and with the non-communicable disease and with something else more.
Definitely.
Well, with that, Monica, I'm going to stop sharing and we'll go ahead and transition to our next speaker here.
Thank you.
Awesome.
I think we had a really nice transition from Dr. Ricardo to Professor Marija, as we already had some impressions shared. So please, Dr. Marija, thank you.
Thank you. Thank you. I will share my slides. Okay. You see all. Thank you. I would like to thank you first for the invitation, and I'm glad to be here and share with you my about this important topic, climate change challenge in the light of One Health approach. At a time when declared the global pandemic, climate change was mostly at the forefront of decision makers' conversation and agendas. It was considered to be a crucial time to take decisive actions to protect the nature of the planet. But the world's spotlight moved away from climate change as the impact of the pandemic wore on. We are living now in the heart of pandemic crisis, hoping that it will be soon over and afraid of fourth wave. But there is a maybe much higher, more long and bigger trouble for climate change. You all know that key facts that climate change affect by direct healthy effects, indirect health effects, and that climate change has environmental effects by rising temperature, extreme weather, air quality impacts, and vector-borne disease. So we can say that climate change factory is its full capacities produces direct and indirect climate change byproducts. And our priorities, it's climate change and health issues together with all SDGs. I'm here also a representative of environmental and health section EUPHA, and also a professor of public health in University of Novi Sad medical faculty. So my favorite topics is environmental and health issue, and also SDGs. Health and well-being, as you know, and climate action are separate and important goals. But question is whether we as humans are selfish and anthropocentric, and whether we understand and read the definition of health in a proper way. I would like to mention one of our most famous writer and philosopher, Borislav Pekic. I'm coming from Serbia. He says in his novel, as soon as we became aware of his power, man began to threaten nature as some random, unbearable oddity in the structured order or artificial things in the world of his own products, which would otherwise, without nature, be perfect. So our behavior to the nature is really inadequate, aggressive, and very unrespectable. I think in the light of health, it's also important to mention and underline Paris Agreement adopted in 2015. All the experts present there, even though most of them are not health professionals, while discussing climate change, are directly or indirectly arguing that climate change is practically and ethically essential to caring about public health. Climate change is increasing the frequency and intensity of extreme weather events such as heat waves, droughts, floods, and tropical cyclones, aggravating weather management problems, reducing agricultural production, food security, increasing health risks, damaging critical infrastructure, and interrupting the provision of basic services such as water and sanitation, education, energy, and transport. But these impacts are not important only to humans, but also to animals, nature, biodiversity, and that fact leads us to One Health approach. On one side, we have climate change challenge, and on the other side, we have One Health approach. But when we talk about health, we can talk about health of population, but it is not enough. We have to talk about sustainability, to think about SDGs, environment and biodiversity, and we can use cooperation with public health, global health, population health, and planetary health approaches. The One Health Global Network defines One Health as an approach to improve health and well-being through the prevention of risks and the mitigation of effects of crises that originate at the interface between humans, animals, and their various environment. So the One Health approach recognizes the importance of integrating human health with animal health, but also environmental issues, especially in climate change. And as you can see, this beautiful picture of some researchers, when they talk about that it's important that humans reconnect with natural past and accept the dependence of our planet's ecosystems, that humans recognize dependence on ecosystem services, the very aggressive impact of our development to the nature, and accept responsibility towards future generation. And you can see that ring of the climate change in the green, it's very important for the One Health approach. The main objective is to synthesize the evidence supporting the One Health approach and to enhancing health within the environment shared by human and animals. The links between human, domestic animals, wildlife health, and the environment request an interdisciplinary and multidisciplinary approach. As it is well known, climate change affects the social and environmental determinants of health, clean air, safe drinking water, sufficient food, and secure shelter. One Health approach is a part of solution these major problems for our community and population. The One Health approach includes the environment as the only and irreplaceable component of importance to human and animal health. But One Health is a very complex issue, trying to save under one umbrella humans, animals, and environment, not only locally, regionally, nationally, but also globally. As we know, the reappearance of a previously known infection disease after a period of disappearance or decline in incidence is known as reemergence, and Ricardo talked about that. We are confronted with this because of climate change emergency above other things and factors. One, health and global health security in the time of explosive pandemic potential is a huge priority for all of us. In that line, it is important to mention primordial prevention and environmental protection, then primary prevention and secondary prevention. It is very important to make and improve relationship between veterinary medicine and human medicine, and also with other experts. Global food safety and security faces numerous challenges as the human population continues to grow. In the 21st century, challenges will continue to center of increasing food security globally, with food that is safe and nutritious not only for humans, but also for animals. One more challenge connecting with climate change and animals and humans. The WHO has listed antimicrobial resistance and as among the 10 biggest global threats. Yet, despite the danger, the issue is hardly on the public interest. It is a common challenge to veterinary and medicine experts boasted by climate change. We have to be aware with that. And for my key messages for the takeaway, I would like to mention EU Green Deal and SDGs that could be very important strength and give us arguments for research, guide advocacy, and all the types of actions that will contribute to improving the environment, combating climate change within One Health concept as well. And of course, EU Green Deal with the Global Paris Climate Agreement and SDGs should be guiding principles and policy pathways for all the experts in One Health approach, not only public health experts, as we mentioned. Also, we as a health professionals, together with other experts, could use positive synergy of One Health and public health approach to achieve better health, healthier environment, and climate change mitigation adaptation activities. Connecting with that, key message is also that the climate crisis impacts human health because it puts at risk access to clean air, safe drinking water, nutritious food supply, and safe shelter. Of course, professional groups from different sectors need to work together to prevent the overuse of antibiotics in human and animal health, which can lead to antimicrobial resistance. That's one of the very important One Health actions. And also taking a One Health approach, recognize that the health of ecosystem cannot be separated from the health of all humans, animals, plants, and their living environments. Also, it is very important to mention that the key message for us and the future generation is no human-centered thinking. We have to be aware of our anthropocentric nature and tendencies and use possibilities of our individual roles in One Health approach and in a climate change issue. We could have One Health approach and One Health policies, but without One Health actions, without One Health interventions, we cannot save the biggest problem, climate change and risk of new re-emerging infections disease. And Of course, it is possible by requesting that academia consider adding courses of anthropocentrism, maybe in the hopes that it will influence attitudes and behaviors that inherently value not just humans, but all species and environment on Earth. Thank you very much for the time.
Thank you. I think it was a very important presentation. I totally agree. We cannot think only in terms of the health of people, the health of the ecosystem, and we cannot be separating those. And I further agree with your idea that we need interdisciplinary and multidisciplinary approaches, because only together we can really bring sustainable changes. Thank you. Charlotte, please.
And we have another question to engage with our audience. If you go back to that chat, it'll take you to our next question. I'll share my screen here. Better together. Sustainable. Challenging. Justice for animals. Fair to future generation, collaborative, inclusive, networking, connected. Many unknown unknowns, hopeful, change of diet. Ecosystem restoration. Preventative. I think we have some really good descriptions. Oh, something else came in. What is this? Holistic. It's a good one.
I think my favorite part with word clouds is finding the words that just came up.
I had to move my head a little bit. Monica, would you like to introduce our next speaker? I think we got some good words for this interactive.
Thank you. And I also see the silver lining of together, I see respectful, networking, connected. I see all this multidisciplinary and togetherness, which I highly appreciate. Thank you. And now I'd like to give the floor to Dr. Peter Löffler. Thank you for being here with us.
Many thanks, Monica. I think, Charlotte, yeah, exactly. That's what I wanted to do. Let me just share my screen. So you should be able to see that. Good. Well, so good afternoon to everyone in the room. And many thanks for Monica, Marie, and her team for inviting me to this webinar on an interesting subject. So I'm Peter Löffler, and I work for the European Commission's Climate Action Directorate General. So the first thing, and I can't move my slides now, I can move them. The first thing I would want to say about climate change is that we really need to make every effort to cut as fast as possible greenhouse gas emissions. that the European Union is actually poised to do exactly that. We will have very soon the approval of the European climate law, which will put climate neutrality by 2050, make climate neutrality by 2050 a binding legal requirement for the EU and its member states. And we are working hard also on a more ambitious interim target already by 2030, a minus 55% reduction of greenhouse gases. And from a health perspective, the interesting thing is that if we decarbonize and defossilize our energy systems, this comes with very significant health co-benefits. What you see here on these slides are sort of the particulate matter emissions in Europe in the last winter. And the peaks in Poland, but also northern Italy, for example, are due to fossil fuel combustion, and in particular, combustion of sort of dirty fossil fuels, like coal or also wood, by the way. And this goes along with a lot of disease and also really death due to air pollution. Maria popped up a cartoon. I have another one here. The sad news is, however fast we cut greenhouse gas emissions, climate change is already here. Regardless of how good we get with climate neutrality, it is here to stay for the rest of the century and to get worse. And the speed with which climate change has arrived just in the last few years really has taken many of us by surprise. And climate change will come with a big rucksack of health consequences. The big killer of climate change for the time being is heat. And I don't need to tell you about the heat waves which were just hitting Canada and but also Northern Europe. We had 2 days ago 34 degrees in northern Finland. And so we have record-breaking temperatures, and this is going to be continue. A summer like 2018 will probably be normal in 2050. There are also significant health risks, from floods, food and waterborne diseases, direct impacts again from floods and forest fires, and also, and this is the theme of today's the webinar really, infectious disease risks which are sensitive to climate. In the last couple of years also, a great number of authoritative and major reports have come out on which basically make the point that climate change is also an impending health emergency. And this point is now well understood. Now the question is, of course, what can we do about it? There are many solutions at hand, but the fact is that the knowledge on climate change and the health impacts can always become better. It's also scattered about many different sources, organizations, and regions. We will need to sort of bring this better together, and we will need to find ways also to support public authorities and health system actors in having the right projections for health problems, in improving their preparedness, the prevention, and their response capacity, really, like Ricardo said earlier. And to support really these needs, we have been setting up at the beginning of this year the new European Climate and Health Observatory, of which you can see the link here on the screen. The Climate and Health Observatory, first and foremost, it's a partnership. The climate health and climate change and health theme is beyond the capacity of any single organization or country. And so we're in the very lucky position that we could be teaming up here with many actors in the field to launch this unique initiative. So there's the European Commission, there's us, the Climate Health Action Directorate. We work with the Health and Food Safety Directorate in particular. We teamed up with the European Environment Agency, but we also have the WHO on board, the Lancet Countdown, the European Center for Disease Prevention and Control, the European Food Safety Authority, and several parts of the Copernicus Earth observation system. And all of them are to play an important role in this observatory, because this observatory is very much about really allowing decision makers and politicians to visualize and to see and to anticipate the health risks of climate change, and also to support them to take action to respond to these risks.
Sorry, just a quick second. I think you might have opened the chat or something because you have a black block covering part of your presentation.
I didn't, and this must be, no, my screen looks actually fine.
Like right here where you are now with the click, there is the black block, which is a bit strange.
Is it getting better now?
Yeah.
Okay, that was the video screen, I think this was up. Well, it shouldn't be like this, but okay. I hope it solved it.
Great, thank you.
Okay, super. So the Observatory is a partnership. It is also a web portal. This is like basically a screenshot. What you get on this web portal is the European policy context on health and climate change. You have a significant section on evidence and climate and health, which sort of gives you information on the health effects. There's a section on indicators, on projections and tools, and on health warning systems. And also there is a resource catalog and a publications and outreach section. Now, sort of focusing really on infectious diseases and climate change, as Ricardo already said, many factors play a role in the emergence and spread of infectious diseases. But we also see a growing strength of the climate signal in the sense of climate-sensitive pathogens and vectors. And what you will find on the observatory, for example, are maps and projections of the changing distribution of infectious disease vectors, like here, for example, and pathogens, like here, for example, the West Nile virus infections. Now, this is a disease which is called West Nile virus, but we will actually have a growing amount of it in Europe unless we take, of course, action to prevent and curb these risks. Now, whilst this is a static map, quite interestingly also, we have been developing with the EEA a more dynamic tool, which is called the European Climate Data Explorer, which went online just a couple of weeks before, which again, you can find on the Observatory website. And this Climate Data Explorer, based on the Copernicus climate data, allows you to visualize this data, for example, here by looking at the projections for climatic suitability for tiger mosquitoes in Europe for different periods, but also for different countries. And you see this, for example, here as a thematic map. And well, I'm talking to you from Belgium, so I popped up here sort of a graph for Belgium, which shows sort of an index of the climate suitability for this disease transmitting species. And this is important, of course, to help you estimate your risks and to take preventive action. I think we all had our share of this now with COVID, so I think we got all good in reading these maps and these graphs, and we got a bit of a better sense of what it means to anticipate and curb such threats. At a glance, really, coming back to what the observatory is, it is a partnership, as I said. It is an online knowledge portal. Because we bring in different partners with different capacities, I consider it very much a creative lab and a tool developer to develop new tools, such as the Climate Data Explorer. We have a communications and outreach program. I'm talking to you today. We're doing many more actions around the observatory. And of course, for us from the European Commission, as a policymaker, we consider this something which really helps us to design policies and to implement them. And here specifically, of course, policies to address the health consequences of climate change. What I also want to say is that the Climate Observatory is linked to relevant EU initiatives and programs. We have links to the Copernicus Earth Observation System. We have links to, let me just look at my list, the European Health Emergency and Response Authority, which we have in the planning. We have links to the Horizon Europe Research and Innovation Framework Program with its €3 million adaptation mission, and so on and forth. We also bring in the EU member states. There are different types of authorities and different groupings, and we have sort of these committees and groups where we bring them in and distribute to them sort of the outcomes of the observatory. And finally, our colleagues from the Health and Food Safety Directorate, they have sort of this health policy platform, which is also a platform to link the observatory to civil society. And just a bit more concretely, really, for this year and next year, we actually try to focus the work of the observatory on climate-sensitive infectious disease threats, i.e. today's theme, and heat stress. As I said, heat stress, big killer, and infectious disease threats, well, I don't need really to say a lot in the context of the COVID pandemic, I think. For these two threats, we will work with the partners to develop meaningful risk indicators, indicators which do not just measure hazard, but also exposure and vulnerability, risk assessment tools like the Explorer, which I just presented, useful background knowledge, and very importantly, also actionable solutions and good practices, which, for example, authorities in the member states or also in cities, local authorities can use and apply. And just very concretely, what we have in the pipeline for this and next year is the first edition of the European Climate and Health Report in cooperation with the Lancet Countdown. We have an ongoing preparatory action for the European Health Emergency Preparedness and Response Authority on climate change and infectious diseases, and the results of that exercise will go on the observatory. The colleagues from the European Center for Disease Prevention and Control are working for on a web-based tool for sort of near real-time prediction of Aedes-borne disease outbreak risks, mosquitoes, Aedes aegypti and albopictus. And the Copernicus Climate Change Service is also working to basically fine-tune and improve the tools, just like those which I have been showing to you before. That's all really I had to say. I hope this was an interesting overview. Back to our moderators, and I hope I can answer any questions that may come up. Thanks for your attention.
Thank you, Peter. Yeah, I think it was great, and it's so good to have this kind of agencies and initiatives that can better facilitate this. And I think that everyone that is here today is happy to hear about this kind of initiatives and the options that they can have and reports and everything in between. Thank you. For now, if we have any questions, you can directly raise your hand. So we can unmute you and you can share directly with us the question.
Come on, don't be shy.
If not, I have a sort of classical question, as you are representing the Next Generation Network, and you are experienced, and you have a lot of things to share with us. What would be your one advice for the next generation?
Well, I would say keep being curious, because being curious is part of finding new things, and therefore public health is an evolving field. One might think that it's like crystallized and there's nothing to improve, but it's not the case. I mean, there's a lot different things that one can do in public health, and therefore keep being curious and trying new approaches, trying different settings, different contexts, different approaches is surely the path forward. So all younger public health experts or trainees are very welcome in the different settings. And I guess my experience in involving them has been very, very positive. So do come forward and present yourself, and surely we'll find things to do together.
Thank you.
Maybe I can come in. I would also say, fight for your rights and your future, and raise the political pressure, really. Working on climate adaptation is not fun, really, because we're confronted with all these projections, and they're really not good. And what we see in the political decision is quite often, we have many sort of middle-aged to old people, experienced people in policy making, but also our life calculus is, for us, maybe it may just be still okay. And for climate change, we will get away with it. But if you look at the projections, from 2040, 2050 on, we risk living in a world which is really very, very difficult to live in. And so we need to be pushed to take decisive action right now. And movements such as Fridays for the Future, or young people protesting also for being, always getting sort of the worst cards for COVID, being late to be vaccinated, having to lock down, but not actually being vulnerable so much. These are serious things, and I think your voice must be heard, and you must sort of protest and make your voice heard, and coax us and to sort of take action now. Thank you.
Thank you as well.
I would like to add, I agree with Peter and with Ricardo, and as a university professor, I advocate to stimulate innovative approach. And you are, as a leader in public health, young leaders, you are leaders in innovative approach in education process to tomorrow and today. And it is important to include One Health approach, as we can see that Peter talked a lot about climate change as an important issue, but it's not only about research, it's about action. It's about primordially prevention. And as we mentioned that, I think that we had made an oversight a few decades ago, hoping that we had solved some crucial problems regarding these. We focused on dedicated to non-communicable diseases. Now we have two big unsolved challenges, re-emerging infectious disease, increasing in non-communicable disease, and a big threats climate change issue. With personal change and change of mindset at individual level, we can make something locally, nationally, and globally as a citizens. And we, as a health professionals, and you as a health professionals, you have to be leader in your environment, in your community, in your neighborhood, with cycling, with running, with healthy eating, etc., at the individual level. And innovative approach and curiosity, of course. Thank you.
Thank you. I think all these inputs are so valuable, both for me, but of course for those that are here with us tonight, because it is so good to hear new and fresh perspectives. And I think sometimes the same perspective, because I think it validates some things that you have within. But going further, we have a question in the Q&A section. Sorry. Apologies. And we will answer it live. And the question is, since climate change is an unstoppable phenomenon, how many effects can we expect from the suggested interventions to curb, for example, the spread of infectious diseases? Dr. Ricardo, Dr. Peter, Dr. Marija?
I guess that there's for instance, the fact that vectors are now showing up in different areas is something that's a significant concern. So on the one hand, I think we need to have significant surveillance tools to be able to detect these incursions of the vectors. And also probably we need to try and find ways to avoid mosquito breeding structures, try and find where they're breeding and remove those structures. So it's really, I mean, if you look at countries where malaria is endemic, for instance, it's a very difficult task. I mean, they've been struggling with it for decades. So it's really something that needs to be put in place at an early stage so that we prevent the spread of disease. I can share the experience we've had, not with malaria, but with dengue in Madeira, which is the islands in the Atlantic that are from Portugal. And they somehow overlooked the fact that they had the mosquito was introduced into the island. And of course, it's not an issue if you don't have people with dengue arriving in Madeira, because you might have the vector, but if you don't have the disease, it's not a significant problem so far. But the problem was that they have a very strong connection with some Latin American countries, namely Venezuela, with a significant community of people from Madeira in Venezuela. And of course, many of them come and visit the family in Madeira. And that set the stage for a significant outbreak they've had with dengue, which was difficult to contain. And therefore, we need to be more proactive than reactive. And this is just an example there, but I'm sure there are dozen other examples where we need to be on our toes to find the issues before they get large enough to be really a significant problem.
Maybe to echo what Ricardo says and to reinforce what he's saying, I don't see a reason to fall into what we could call climate determinism. The emergence and spread of infectious diseases depends on many factors. As I said, climate, we see a clear strengthening of the climate signal, but this has also to do with global travel, global trade, the capacity of public health systems, many other factors. What our experts from the European Center for Disease Prevention and Control always tell us is, and they have evidence to show that also, is if you address these factors and if you engage really in what we could call a good public health practice, i.e. really, good prevention, good surveillance, good preparedness, you can even overcompensate the additional risks of climate change. So the secret here really is good practice and really investment in the necessary public health capacities. And here we have, of course, we are still a bit victims of the underinvestment in public health services in the context of the financial crisis which we had in the past. So there is, as I say, there is reason to be worried, but there are also some good news here.
It is. I want just to add the importance of interdisciplinary and multidisciplinary approach, and to provide principle the health in all politics, and focus not only on adaptation, waiting for a infection disease, but also mitigation process in connection with other experts, like part of primordial prevention. It's very important.
Yeah, I think I agree with you, and I would like to ask Zineb if there is a follow-up question to what has been answered, or if it's okay with the current answer. At some point somebody raised his or her hand, but I cannot. I wasn't able to see whom did that. So if you have further questions, you can either type them in the Q&A section, or you can directly raise your hand and you will be unmuted and you can directly ask your question. We will wait a few more minutes to see if you have any other questions. And in the meantime, I'd like to thank you once again, Professor Löffler, Professor Jevtic, and Dr. Mexia, because I think it was so important, and I did enjoy so much, especially me. I usually work within the workforce sector, so for me it was like a breath of fresh air, because I went in a total different field. And I see that people are sending messages that they enjoyed it as well. And we have a question regarding HERA. What do you think will be the key challenges in setting up this new authority? Peter, please.
What will be the key challenge? I think look, I mean, we are not the lead service in setting up HERA, but I'm involved in the process to some degree, looking in particular really at climate change and health. I think the necessity for an authority an authority which sort of meets these functions is uncontested, and decisions are always taken between the European Commission, European Parliament, and member states. A lot of the discussion really focuses on where this new authority sits, how its responsibilities may overlap with the responsibility of other authorities, and or put positively how it can be combined with the existing system, what its competences are, what its boundaries are, and I think so. One of the challenges really to sort of find the right position for this authority. And of course, that in a context of a European Union where responsibility for health lies with member states principally, and for a very good reason, but where also this distribution of responsibility in member states has also shown its limits. So we are having here some debates about in what areas the EU actually needs more and stronger competence to be able to react to a pandemic like COVID or future pandemics, and where it is absolutely appropriate to leave basically the member state prerogative in health policy and say, each member state deals best with it on their own. I think these are sort of some of the really interesting discussions. And I guess you could also call them challenges.
Thank you. Do we have any other questions, please? If not, in this case, thank you once again for our amazing speakers. Thank you for joining us and for supporting the young generation. I am repeating myself, but it is highly appreciated. And thank you for your kind participation. And now we will continue with the networking session. So what I will do is I will promote everyone to panelists. So everyone can join and speak, and we can share with you if you have questions for us, if you have more informal discussion. But of course, Peter, Maria, Ricardo, it was so kind of you to stay with us a bit longer than expected. So we are totally understanding if you have to go, and I don't think
I may have to leave, I'm afraid. Sorry, thanks for your understanding. Some other jobs to be done, but it's great to be with you, and many thanks again for the invitation and for your attention, and also for Ricardo and Maria for being with me on the panel. Good to see you, and nice afternoon to everyone.
Thank you.
Thank you, you too. Bye bye.
Thank you. All the best, Peter. A pleasure.
Thank you.
Share the floor with you.
I almost promoted everyone to panelists. Charlotte, Laura, I don't see you here. Yeah, I think we're here all. Hi, I see some familiar faces. Hi, Ines. Hi, Mari. Thank you for joining us. How was the event for you? Do you have any feedback, any questions? I would really like to hear from you. I don't have wine. I'm still at work, but I do have coffee. You cannot see my mug, but yeah, here I have coffee.
I just have a quick question, because for me it still says that Chiara and Domitilia are still on viewers. You cannot promote them?
You have to accept to be promoted to
okay.
panelists. So I've promoted them, but I think they have to still to accept.
Well, I'd like to thank you for the opportunity and the chance. And you have my email, so if there's anything that I could be of assistance, just feel free to send me a message. And I'll be looking forward to meet you all in the next European conference. Unfortunately, it will still be virtual, but hopefully in the near future, we'll be able to be together in a real venue, in an on-site venue. So
Hopefully
all
in
the best.
2020, 2022.
22,
Thank-
yeah.
Thank
All the best. See you
Thank you,
around.
bye-bye.
thank you,
Bye-bye.
Ricardo. We will stay in
Thank
touch.
you.
Marija.
Thank you all. I wish you all the best. You have my contact, so we will keep in touch. Bye.
I will now stop the recording as well. So